Welcome to this education video entitled Assessment and Management of Youth Depression. This session is a component of our Primary Care Behavioral Health Primer Education video series designed especially for pediatric primary care providers. My name is Megan Benoit Ratcliffe. I'm a pediatric psychologist with Children's Healthcare of Atlanta, and I'm delighted to be your presenter for this session. A bit about me: I'm a pediatric psychologist with 9 years of postgraduate experience, working in both inpatient and outpatient settings across a variety of illnesses and conditions. Caring for those in need is, I believe, one of the highest callings. I hope that you'll be able to take away from this series information and ideas that will help you in the important work that you do. A brief disclaimer: this program offers general information and is not specific medical advice. Always consult with a doctor or other healthcare provider if you have any questions or concerns about the care or health of a child. In case of an urgent concern or emergency, call 911 or go to the nearest emergency room right away. For immediate concerns related to a patient suffering from depression or other behavioral health crisis, call the Georgia Crisis and Access line at 1-800-715-4225. This line is staffed with professional social workers and counselors 24 hours per day, every day, to assist those with urgent and emergency needs. I do not have any financial relationships or other conflicts of interest to disclose. The primary objectives for this presentation are to discuss up-to-date information on youth behavioral health and mental health risk factors, specifically related to youth depression, to identify unique strategies for youth and caregiver assessment of behavioral and mental health issues, and to develop a plan for managing and triaging behavioral health and mental health issues within the parameters of your current practice. This youth depression series is segmented into 4 sessions. The first session provides a depression overview. The second session provides assessment strategies and differential diagnosis. The third session provides information on how to incorporate caregivers in the assessment and treatment of depression. The fourth and final session provides information on how to assess and treat youth presenting with depressive symptoms. Let's begin Session 3, Caregiver 411. Caregivers are experts in their kids. Even when youth may not be able to articulate what they are experiencing or feeling, caregivers may be able to provide some important insights. As such, it is important to rely on multiple informants in assessing and treating children and adolescents. Here are some general strategies and information to keep in mind when incorporating caregivers in the assessment and treatment of youth depression. Current reliable data describing pediatric depression screening practices among primary care providers are lacking. The limited information from the past decade that is available is based on clinician self-report. Results of these surveys indicate 90% of pediatricians believe identification of depression is their responsibility, but less than 50% have confidence in their ability to do so. One of the main objectives of this training is to empower those who want to feel more confident. 64% of providers in community practice screen for depression, but only 3% document screening. In the challenging world of healthcare reimbursement and accountability, it is important to document what you can for improved patient care. 50% of pediatricians report making a diagnosis of depression based on their overall impression and assessment of 1 or 2 symptoms. Based on the criteria reviewed in Session 1 of this series, we know that diagnostic criteria requires more than that for accurate diagnosis. 17% of pediatricians use formal criteria for diagnosis. While mental health necessarily relies on subjective reports from patients and not objective laboratory data, it is nonetheless important to be as systematic as possible to ensure consistent quality care. Less than 1% of primary care providers use screening instruments. While there are barriers to using assessment instruments, including time, an added step in the check-in process, and extra documentation, the utility may ultimately make use of screening instruments worthwhile. As previously mentioned, caregivers are experts in their own children, though they may not always know the things to look out for in differentiating normal youth development from more serious mental health issues. Encourage caregivers to look out for the following red flags so that they can help support and advocate for their kids. Problems across a variety of settings. For example, caregivers may see changes in emotions or behaviors at school, in extracurricular activities, and at home. These across-the-board changes may indicate more pervasive concerns. Changes in appetite or sleep. Normal deviations do occur with growth spurts and seasonal changes, like later sleep and wake times during the summer. But significant and extended changes, either an increase or decrease in appetite and/or sleep, should be noted. Social withdrawal or fearful behavior towards things your child normally is not afraid of. Withdrawal from normal activities and relationships occurs in over 50% of youth depression cases. Regression to behaviors more common in younger children, for example, bedwetting or resuming thumb sucking, after these behaviors have been extinguished. Regression may be seen as sometimes unconscious attempt to cope and soothe using prior coping mechanisms. Appearing sad, tearful, or irritable. All kids have different personalities. Some are more emotional or volatile than others. Whatever the child's baseline temperament, encourage caregivers to be vigilant from any changes from baseline that appear to last for more than a week. Signs of self-destructive behavior. Kids who struggle with depression are more likely to engage in risk-taking behaviors such as excess drinking and drug use, unsafe sex, gambling, reckless driving, and cutting. These behaviors can be an attempt at self-medication and temporary relief from intense emotional pain. The consequences of self-destructive behaviors, however, can be devastating. Caregivers should be encouraged to look for the root cause of these behaviors rather than just punishing them. A focus on death. This focus can be theoretical, for example, where do people go when they die? Physiological, for example, what is the process of dying like? Or spiritual, for example, will I go to heaven? And nature. Overfixation on these questions may indicate more than normal curiosity. Preparing for death by giving away favorite possessions and saying goodbye. There is often a desire to tie up loose ends and make amends before committing suicide. Finally, sudden elevation in mood. Research indicates that people who are severely depressed who decide to commit suicide sometimes have a sudden elevation in mood as they anticipate the final release from their pain that they believe will occur with their death. Other signs include giving favorite possessions away and saying goodbye to loved ones. Caregiver talking points are key takeaways that you can provide to families when discussing depression. These are the big picture things that you want caregivers to remember when they leave the office. An important takeaway is that depression is the most common mental health disorder in the U.S. among teens and adults. Caregivers should be aware of the risk for developing depression so that they can be vigilant in watching for symptoms and providing prophylactic support. Caregivers should also know that, as mentioned in the previous slide, depression is associated with other at-risk behaviors. Depression is not benign and should be taken seriously. If youth are engaging in risky behaviors, caregivers should be advised to look for the root cause rather than just responding to rule infractions. Caregivers should know that depression is likely to reoccur sometime across the lifespan. There is data to suggest that teen depression may be more common among adolescents who have a family history of depression. Thus, they may have a lower threshold for future episodes. Thinking of depression as a potentially reoccurring disorder may make it more likely for families to seek treatment that can delay or minimize symptoms. Finally, families need to know that treatment can be beneficial. Fewer than 1 in 3 teens seeks treatment for depression, the result of which may be prolonged and unnecessary morbidity and mortality. Reinforcing that mental illness is not a personal choice or a character deficit may help families move beyond the stigma that still remains. Once caregivers are aware of the red flags for depression, they can benefit from knowing strategies that will help them to prevent or minimize the occurrence of depression. The first and most important piece of advice for caregivers is to listen. Out of a desire to protect our kids from harm, we may end up talking over them or lecturing them. The truth is that they know a lot and are experiencing a lot. Kids who see their caregivers as a reliable sounding board may be more likely to go to them in times of need. Next, caregivers need to be reminded not to minimize their child's subjective experience. What may seem trivial to an adult can be catastrophic to a kid. As with adults, sometimes the emotional response to a situation is not about the situation at all, but the extenuating circumstances or the accumulated stress in one's life. Being present with compassion and not judgment can go a long way in reinforcing trust. Caregivers need to allow kids to make mistakes. Overprotecting or making decisions for teens can be perceived as a lack of faith in their abilities. This can make them feel less confident and give them fewer opportunities to build up the autonomy they need to succeed in the world beyond their family of origin. Allowing kids to experience natural consequences will facilitate their growth. Caregivers need to be reminded to allow kids to forge their own path. Too often, caregiver expectation of their kids stem from the caregiver's own wants or needs. Allow kids to create their own identity, even if it means they don't follow the path of those before them. Pressure to live up to caregiver expectations can be a major stressor for kids. Caregivers need to be encouraged to keep the lines of communication open. Kids' relationships naturally evolve, with increasing reliance on and influence from peers as they get older. Caregivers should remain available and should continue to engage, not taking personal offense should their teen withdraw at times. Caregivers should be firm in setting rules and calm in enforcing them. However much kids may complain about boundaries, they serve as safeguards. Executive functioning skills, including impulse control and cognitive flexibility, are not fully developed until early 20s. When rules are broken, don't take it as a personal insult, calmly enforce the rules, and model good emotion regulation for your kids. Caregivers may not always be the go-to person that their kids seek out in times of stress. Eliciting support from close friends or family members that your child is close with makes sure they have some safe outlet to rely upon. Caregivers should limit access to potentially harmful means. Almost half of all completed suicides by those 14 to 19 years of age result from guns. Access to alcohol and prescription drugs in the home can be destructive in the hands of someone desiring to engage in self-harm. Finally, caregivers need to manage their own mental health issues as needed. Again, this provides a good role model for youth, and it ensures that caregivers have the capacity to deal with the trials and demands of all that their families are going through. For more detailed information on how caregivers can support their teens' healthy development, please visit some of these quality websites. This concludes our third session, Caregiver 411. The next session, Youth 411, will focus on specific strategies for assessment and treatment of depression for youth populations. We hope that you found this video useful and informative. From Children's Healthcare of Atlanta, we thank you for watching this video.